Good morning, everyone. Dan Bates, President and CEO, Greater Hamilton Chamber of Commerce, and thank you for joining us for Coffee and Conversation. We are going to be hearing from Mitzi and Sage in just a little bit, and they will do self-introductions and everything when that time comes. But this is the deal. We are on Zoom. So if you have any questions during their presentation, they will not mind if you raise your hand or interrupt them and ask those questions. If you're on Facebook Live, which is usually our larger audience, type those questions in and Laura will get them answered for you. So you know who I am, and now we're going to find out who all of you are. So Jason.
Yep. Good morning, everyone. I'm Jason Michael Miller, Director of Membership for Greater Hamilton Chamber. We have Maria on. Can you introduce yourself?
Can you hear me, guys?
Yeah.
Yep. Yeah.
Okay. Good morning, everybody. My name is Maria from Migoria Event Rental. I'm one of the owner of Migoria, and we are here located in Hamilton. Our company specializes in complete event package, from 10 table chairs and all logistics for the event, like delivery, setup, and that's it. Thank you.
Maria will have plenty of events for you to have rentals at. Next, we have Laura.
Good morning, everyone. Laura Merrill with the Greater Hamilton Chamber.
Next, we have Jill.
Good morning, everyone. I'm Jill Cates with Easter Seals Redwood and Workforce Development.
Awesome. And then we have DM.
Yeah, let me get myself off of mute here. Yeah, this is Don Martin. I'm with Martech Solutions. We are a technology solutions advisor from small business to corporate enterprises.
Awesome. Hey, thanks for being here with us today. So we have all the introductions right now. We might have a few more people that kind of join throughout. Mitzi, Sage, whenever you're ready, you can take it away.
All right. Good morning, everybody. I'm going to share my screen. My name is Sage Scharre, market leader at Emerson Rogers. While this is, I think I had a request to share to one of you. So I don't know if Laura, Jason, or Dan got
I got
that.
you. You should be allowed.
Perfect. Let me know when you guys can see my screen.
Says you've started. Yep, there it is.
All right. Well, again, to kick off, good morning, everybody. Really appreciate you guys taking time out of your day. My name is Sage Scharre. I'm the market leader, like I said, for Emerson Rogers. Today, we're going to talk about employee benefits. So group insurance of all types. And really, we're going to start with kind of the issues with the healthcare environment, how the employees and just consumer navigates it, and kind of solutions. So I'm joined with Mitzi Hernandez on the phone. I've been in the industry for 13 years, started in property and casualty. I've done everything from individual and Medicare to large groups. I have experience on the carrier side, the broker side, and then now my side now is called a general agency. So what I do is I work with local insurance brokers like Mitzi to really do what's best by the community. We help equip our local brokers with tools and services to make sure that employer groups are getting the best rates at the lowest cost and obviously making sure that the member experience is there. So looking forward to talk to you guys for the next 30 to 45 minutes. I'm going to throw it over to Mitzi to introduce herself.
I'm Mitzi Hernandez. I am an independent insurance consultant. I've been in the employee benefits industry for 8 years now, and I work with small to large groups, but mainly focus on groups under 25 employees, because I feel smaller groups are often underserviced. And I'm licensed in 3 different states. I'm licensed in Ohio, Indiana, and Kentucky.
Awesome. Thanks, Minzy. So we're going to start today with just going over the high and rising costs of insurance. Obviously, no one on this call is naive. This is a broken system and it's a mess, right? Prices increase every single year. I'm sure that you guys as employers go to your broker or go direct to the carrier every year and have to be given a high increase. Normally, this goes from anywhere from about 12% up until 80%. These are ongoing, and this is really a combination between the federal and state government, the carriers, and the hospital systems. Obviously, guys, not only are the rates increasing, but so are deductibles and the overall cost of medical services. As you can imagine, as technology increases, the viability of success with these medical procedures increases, and so does the cost. So, with these three things increasing, the premium cost of the insurance, the deductible amount, and the cost of goods, it's not sustainable. The second issue, right, these high costs and this instability is no alignment. I'm sure we hear all the time, right? Your local hospital system is going to lose a contract with X, Y, and Z carrier. It happens in every state, every major city throughout the country every year. The struggle between federal government and the local state Medicaid offices. I'm sure a lot of you guys are familiar with Medicare and Medicaid and the different funding structures throughout the United States. That causes a lot of lack of alignment. And then finally, the plan cost. Like I started off with, there's increase every year. And as insurance, you may or may not have been explained this before, but your increase could be determined by you as your group alone, but it can also be determined by your risk pool. So in the 2 to 50 space, 2 to 50 enrolled employees in Ohio, we have something called a MIWA. It's just pooled risk. Anthem has one, Medical Mutual, and United Healthcare. And sometimes your increase is just attributed to the pool's risk, has nothing to do with you. So that's really what's attributing to the high costs of healthcare and the increasing costs. The navigation of healthcare, right? It's horribly difficult for a consumer. It's hard to educate, right? I mean, when I was in college, there wasn't an insurance professional degree or anything like that. And there's no more real formal education for any of the consumers. If you want information, you either have to reach out to a local professional, your local chamber of commerce, like we're talking with today, or a carrier of some sort. Constant change in rules and legislation. You know, with the small employer groups, a lot of the compliance issues are on the employer and not the broker or consultant. Again, going back to that lack of education, we only know what we know in life. There's not a book give you the answer to everything. So unfortunately, you're at the mercy of the market, and the system doesn't do the best job educating the employer groups. And multiple products and pay structures. I'm sure everyone on this call has heard from fully insured products to level funding and even the word self-funding. There's all these new words and terminologies being thrown around, but there's not an effective definition, right? And I feel like every year to the consumer, there's people highlighting a shiny penny. And the question that you have to answer as an employer is this sustainable, right? Your goal is to have savings for multiple years, not just 1 year. Rounding this out, just little to no community resources. Like I was saying, unless you have a payroll provider or an accountant or finance or insurance professional like Mitzi, you simply don't understand these rules. And once you do understand and you're involved in a health plan, it's very difficult to understand the benefits. Like I said, there's deductibles, there's co-insurance, there's co-pays, there's HSAs, there are HRAs. All these things can be good, but the proper usage at the right time is really what these employer groups like you need. Not just having products thrown at you with those good explanation of benefits when you get the claim and allowing you to make sure you have to figure out yourself what to do. So obviously that's the so-called doom and gloom over the industry. It seems like it's a mess. It's hard to clarify and make sense of it, and it doesn't seem like a way out. Well, the thing I want to tell you guys today is that there are solutions. In fact, there is always a solution with proper education. So why do you even have employee benefits? Number one reason, I would say, the most important asset in your company is your people, right? Unless you're a sole proprietor without your staff, it's really hard to get any amount of profitability. So the goal is you want benefits to attract and retain employees. Well, how do you do that if it's so expensive, right? That's the conundrum. Like I said, number one asset are your employees, and the benefits package is key to your growth and profitability. But what do I mean by that? Am I saying you absolutely need employee benefits? No. Am I saying you could use it? You could use dental and vision and other lines of business to highlight your employer to make it more attractive? Absolutely. You know, when I do a lot of these talks, I always talk about the concept of fear. And to me, you know, in life, there's some things to be scared of. You know, there's always a bad diagnosis. There's always some times in life it's hard to find the silver lining. I am a firm believer that absence is the fear of knowledge. Insurance and anything in life really isn't scary if you get to learn it. You know, at one point, none of us knew how to ride a bike, and that was terrifying at first. But with education, things became more clear. Bottom line, is you need the right industry partner. That's the total message of this presentation, is the right partner in life of really anything allows both parties to see the fruits bear. And what does that need? I mean, you need a partner that consults you throughout the entire year, not just when your renewal is coming up. This consultant partner should be able to talk to medical, ancillary, and specialty. I always say that definitions matter. There is a difference between a broker and a consultant. You know, my 3-year-old nephew can be a broker. What is that definition? You know, you have a list of 5 different prices and you put the cheapest one at the forefront. What I ask my broker partners like Mitzi to do is be a consultant, right? The cheapest price isn't always going to win. You want a recommendation, and a recommendation that is there throughout the year. Goes with the thing, the cheapest plumber, right? If you go home, you notice your toilet's overflowing, what are you going to do? You're going to call your friend and say, hey, do you have the cheapest plumber for me? Or are you going to ask for someone that they trust and that can give you a solution? You get what you pay for, right? I think there's a race to the finish in terms of cheapest costs, but a higher deductible is not always a solution. I mean, I have a lot of businesses I run across that they have a deductible over $7,000. That's just not attainable for many people. The key is to partner with an insurance professional and expert that is backed by the company and that there's always a solution. So there's a couple of numbers I really wanted to go over to hit this home before I send it over to Mitzi. These are some interesting facts, and I actually picked this up in my last national insurance presentation. But in the United States, and I thought this number was a little low, but I got it kind of clarified, 84,000 is the median household across the country. In Ohio, the average deductible is $4,950, just under $5,000. Again, how can you use that, right? Cheapest isn't always the best. High deductible health plans. So a lot of times in the state of Ohio, I guess generally I would consider that over $5,000. It's associated with a higher cancer mortality. What does that mean? It means that if someone has, let's say, a $7,000 deductible, you're willing to allow a pain to go on and not seek medical attention, knowing that that price is too hard to achieve. What that means is that these high deductible plans, people aren't really using their benefits. So again, you get what you pay for. If you're willing to pay for a price that, you know, gives you a low price but a high deductible, really what you need to think about is who's going to use it. And that goes to the next point. Only 28% of members regularly use their health plan. A lot of that's that element of fear. They're scared to use it because of the cost incurred and the confusion with the navigation of the market. 71% of HR professionals do not like their benefits. That's a huge number to me. A lot of the groups over 51 enrolled employees have a HR professional, HR director, someone synonymous in that line of business. 71% do not like their benefits. And bottom line, employer education and employer engagement leads to better costs, better renewal rates, and just more profitability for that employer. So thank you, Mitzi. I will send it to you to bring us home.
Mitzi, I think your mic might not be on.
No, it's not. Can you hear me?
It is now. Yes, yes.
Hold on. Okay, hold on. Let me move my computer a bit closer. Okay, you can hear me now, right?
Absolutely. Thank you.
Yes.
All right. Well, thank you, Sage. You know, Sage pretty much he talked about medical insurance and what it's all about and some of the variables when it comes to the cost. And what Sage and I, you know, we partner because, as he mentioned, when it comes to employee benefits, I am more a consultant. I'm a consultant, and my focus is really to find a benefits package that's going to help the employees, because at the end, you know, the employees are the lifeline of the business. If a business doesn't have any employees, they won't be able to eventually run their business. And when business owners, when they're bringing people on, the second question that they always ask, the first question is, how much are you going to pay me? The second benefits based on the employee experience. You know, we always want to know the age of the employees, if they have any pre-existing conditions. We want to get to know what's all the employees that we were able to best find a chaperone for benefits package that's gonna benefit all of them. And then again, some benefits package, when I meet with some clients that they'll, their benefits package may sound really good, but they don't look, there's always a fine print. There's always a fine print. It might look really good when it comes to, yeah, they may not have a high deductible, but then their benefits, their copays could be really high. So sometimes it's not just how it looks in the front, you also have to read the fine print. So like it says on here, it doesn't matter how a benefits package looks on paper. It may also look really good, but if the employees, to Sage's point, if they don't know how to utilize these plans, then they're not going to go to the doctor. So they have to understand what they're signing up for. And then also they need to know what's available to them. A lot of people, we're not educated. When we're growing up, that's one of the things, we're not really educated when it comes to medical insurance. We know it's necessary. We know we have to have it if we have to go to the doctor, but oftentimes people don't know everything that it covers. So they have to know what's available to them, when to use it, and how it can help them. And then also when it comes to good communication, oftentimes when I meet with new possible clients, they tell me that they only see their benefits consulting like once a year. They only come once a year when it's open enrollment, and after that, they don't see them until the year after that. And that's what sets us apart. We invest in we invest our time when it comes to helping the business, which I like to say, I see myself as an extension of the business as a benefits consultant, because the HR business owners already have enough in their plate as this. So when it comes to anything benefits related, they know they can always reach out to me or Sage, and we'll be able to help them. And then again, the goal when it comes to insurance is not just to offer insurance. Anyone can offer insurance. Not anyone, but most people can. Most brokers can offer you a benefits package, but the whole point is to make sure that the benefits package, they're useful and meaningful. So on the next slide.
Mitzi, you might cover this in a moment, but I was wondering, typically, what is the open enrollment period?
Yeah, so the open enrollment period for most companies, for most places, it's towards the end of the year. A lot of businesses start looking for benefits around this time. So it's usually like the last 2 months of the year. And it usually ends December 15th. That way they can have benefits starting January 1st. That's the normal, but I know there's a lot of businesses that have it different. That some business may have open enrollment during April, June, July, throughout the year. Okay. All right. So then to my previous point, when it comes to employee benefits, it shouldn't be a one-time, once per year type of deal. Employee benefits should be able to be discussed throughout the year, and if an employee, if they have to get a medical procedure or if they have any questions, they should be able to have that consultant that they can trust, that they can reach out for any questions. Then again, we completely understand, life, it's unpredictable. Our lives change. There's changes in life events throughout the year. So for instance, an employee may sign up for a medical plan for only themselves, and then they might get married, and then they might have children. So that's another thing, there's changes in life that we may need to do changes to their benefits package as the year goes. Then also another thing, we should be asking questions before renewal. That's always with all my current accounts. I always like to start the process of looking into some benefits before the renewal, 2-3 at least few months before. That way we have enough time to shop around and look for other options. And then it's more important to look beyond just monthly premium. To Sage's point, if you have to get work done if you have to get work done in your house, or if you're building a house, you have to have a solid foundation. Sometimes if you're going for the cheaper plan, yes, you may have a cheaper plan and say you have medical insurance, but then you may not cover a lot of things. And then another thing too, 66% of Americans in the US go bankrupt because of medical debts. So that's why it's really important to have a benefits package that it's something that you can afford, but it also has the coverage that you need. So cheap sometimes ends up being more expensive. Okay, the next slide, please. Okay, so why does it win matter? So when it comes to benefits, we want everyone to win, not just the employer and the employees. And again, when it's necessary, find the cheapest plan. And a win, it's when employees understand their benefits and actually know how to use them. The amount of Americans that have medical insurance that don't use it, it's pretty high. And not just that, we know that having medical insurance, it's really important as well, because if people have medical insurance, they're most likely to go to the doctor. And if they go to the doctor, they're able to get their preventative care. A lot of illnesses such as cancer, 1 out of 2 Americans in the US will get some type of cancer in their lifetime. A lot of them can be diagnosed if they have medical insurance, they have access to get the yearly physicals, which in the long term will help them to stay healthier. So that's why it's really important for them to know how their benefits work and everything that they can do. And then, okay, so also, when employee benefits is really good for an employer to be able to attain and attract talent. That way they know they're not just offering insurance, they're offering a plan that's going to be useful for all of their employees. And one thing that we understand that each business, it's different. A local roofing company that has 3 to 5 employees, their needs are going to be vastly different than an account that has 50 to 100 employees. So that's why we always like to get to know the individual business and the employees to try to find a solution how we can best help them. And again, I know a lot of businesses, I really like to work with anywhere with business between 1 and 25 employees, because I feel like they're underserved. A lot of them don't offer any kind of benefits because they feel like they cannot afford it. And that's why sometimes they don't even have a conversation, but we have different options. And sometimes they don't. That's why we are the benefits. That's why we're the insurance experts. That's where the benefits consultants. We're here to consult and give information to the businesses and try to help them find exactly what they need. And the next one. Yeah. And do we have any questions?
I have one. So for smaller offices or kind of like a smaller business, and maybe you can't do this over the call right now, but what would be considered like an ideal benefit package situation?
For a smaller business? Well, so the thing is, with each business, their needs are going to be vastly different. Something that we often deal with, often businesses, we like to use an ICRA plan would be beneficial for them. But again, that's kind of a conversation that it's a very broad question, because a office staff needs are going to be different than a contractor. And I don't know if Sage can probably add something to this.
Yeah, no, that's a good question, Jason. I mean, I agree with Mitzi. Every business has a different need, but it depends what is attractive to bring on employees for that business, right? So a package could be just medical insurance. A package could also be, hey, I'm going to give my employees dental, vision, and a small life insurance benefit. So it doesn't have to be all inclusive. I have a lot of businesses that only give dental and vision. And some, you might have that small group fully insured product, but as you go larger, you might want to take on more risk to decrease cost and go to level funding. So there's a lot of ways to skin it. It's really the purpose of what that business owner is trying to achieve. Good question.
Paige, I have a question. it's probably more personal.
Yeah.
I'm with Easter Seals Redwood. We're a very large agency, probably close to 450 employees. And starting in August 1st, we were switched from Aetna to a self-insured medical plan. I don't
Yep.
even know what that means. All I know is we have all these different names on our benefit card now, and I have to make sure that when I go to anything right now that I have to give them this new card. And I guess it kind of puts us our pharmacies under one thing, and I guess our medicals. I don't know. I don't even understand it. All I know is I have a new card, and I was like, okay, I guess this
Yeah.
works, and they'll be till the end of December, clearly. So who knows if it will change again. But my first question is, what does self-insured mean? And secondly, obviously, is there's no change in the cost of our benefits right now. But I'm wondering if there was a cost benefit for the actual agency by doing this self-insured.
Yeah, so no, great question. And obviously you'll have my information, so happy to take this offline as well. But self-insured sounds like it could be a great option for a group your size. That just means you take on more risk. So in like the 2 to 50 space, a lot of the products are fully insured. You pay a premium every month and you get those benefits.
Mm-hmm.
Well, self-insured, there is stop loss, there's an admin fee, and then there's your PBM, your pharmacy benefit. So a lot of times larger employers go self-funded because you can kind of put the puzzle pieces together yourself, which decreases cost. A lot of times, if you're like 5 or 10 employees, the products just are not out there. And with self-funding, you take on a little more risk. So the gamble is you're willing to pay a little more month to month and be variable, but your overall costs, which they call like an aggregate, you might have heard, is lower.
Okay.
So really, like when I've done self-funding before when I was on the broker side to, gosh, employers 1,000 plus, terrific option. But kind of like what Mitzi and I were saying, it depends on a lot of things, like where your employees are located, what the pharmacy is, and to your point, how easy it is to educate your employees.
Mm-hmm.
Because where a plan like self-funding kind of goes off the rails, it's a terrific option. But it's just because that education, saying like, hey, your network is Cigna, but your TPA is Aetna, and you have to go to X, Y, and Z
Right.
pharmacies.
Exactly.
So it comes down to education. And going back to kind of what I was saying in the presentation, that's why picking a consultant is important. And it sounds like that's what you did. But yeah, I'm happy to get in the weeds for it. But at 450, self-funding I would go with that or that option as an insurance professional. So,
All right. Thank you. I appreciate that.
yep.
And I also have a question too. So when you meet with all these teams, is there any type of benefit that is often overlooked or something that you're kind of like, you really should consider this that a lot of people don't think about?
Yeah. I can take it and give it to Mitzi. I would honestly say ancillary. So it's funny that I lead group medical is what I lead, but obviously I'm adept in ancillary and specialty. So like dental vision and especially life products, like 10,000 to 50,000 in what's called guaranteed issue. So there's no underwriting, there's no questions they have to ask. You pay your premium, you get the benefits, is extremely cheap for an employer. I'm talking like single digit dollars. Dental is probably the most expensive. I would say between 20s, low 20s and like $34, $35. And as an employer, you can make this voluntary or employer sponsored, as in you can pay for it as an employer, or you can have your employees elect for it. So I always tell that, and that's the bottom line. Like I was saying, you don't have to offer medical. You can offer a split combination of either of the 3 or 4 lines, but just offering something is attractive. Even just saying, hey, we have the ability to give you Delta Dental. We have the ability to give you glasses. So,
yeah, I love that. Thank you.
And I would like to add something as well on that, because when it comes to employee benefits, the main reason why a lot of small businesses don't offer medical is because of the expense, because it is, it can potentially be an expense. And we have other products, like ancillary products, or, some of them may know them as supplemental plans that that way they're able to offer some kind of benefits. They can offer plans, like you mentioned, dental, vision, life policy, and there's also other plans such as like short-term disability, which is like a paycheck protector critical illness or a cancer policy. So there are other ways that small employees can offer some kind of benefits that may not necessarily be medical, but they can offer some kind of benefits. And since these plans are voluntary, it doesn't cost anything to the business to offer it. And I know GoFundMe has become so popular, throughout these years, because a lot of people, they have a major accident or they have a major illness, heart disease, cancer, anything like that. Still illnesses like that sometimes will set them back financially. So there are plans, there are other things other than medical insurance. Obviously, medical insurance, it's the main one, but when it comes to employee benefits, there's so much more things that can be offered. That doesn't just have to be that.
Awesome. Thank you.
All right, everybody. Well, I appreciate again your time. Thank you, Dan, Jason, Laura, the board. Appreciate the questions as well. But Jason, yeah, if you can send out our information, and if anyone else has questions, feel free to reach out. But thank you.
Awesome. I'm going to send a little recap to all that registered and the attendees today. Everyone, thank you so much for joining today. Sage, Mitzi, we appreciate you. I was going to put on everyone's radar. We do have some things coming up with the chamber. Allow me to kind of doing double duty right now. Let me pull up the calendar.
Hey, real quick.
Yeah.
While you're looking that up, hey Sage, can you with self-insured, can you do HSA with a self-insured?
Yeah.
And then the lending and loan potentiality is still available on a self-insured?
There's different tax implications. But yes, you can have
But it's available.
Yeah.
We're definitely one of those 70% who's unhappy with our insurance. It's just my wife and I, company of two. But yeah, something we're looking at.
Yeah. I'd say just reach out to Mitzi or I, and we'll connect Chris.
Sorry, Jason.
No, that's fine. I didn't even realize it was you, Jason. Thanks for joining us today. So August 18th, we have a networking leads at lunchtime. You got to eat. You might as well join us for networking. It's going to be at Carmignola, which is on 3rd Street. That's August 18th at noon. We also have a Mix It Up after hours, August 19th, the next day. That's going to be hosted by the Butler County Regional Transit Authority. So we all know it as the BCRTA. We also have Hamapalooza coming up August 22nd at Markham Park. If you would like to have a booth or be a vendor, please let us know. It's going to be a fun time. We see upwards of 8,000 to 9,000 people each year. It's a fun time to be part of the community. And then September 9th, we have our steak fry. Great time to collaborate, mingle with the community. We hope to see you there. Everyone, thank you so much for joining us this morning. Once again, Sage and Mitzi, thank you so much. Have a good day, everyone.